Okay, so today what I wanted to talk about is anusitis, pain and symptoms, how this gets cleaned up with acupuncture. So just from the word anusitis, we know that it is a case of inflammation. Okay, so the suffix itis at the end of anusitis, that suffix itis, it's a Latin term for inflammation. So we see this come up in all sorts of other inflammatory diseases, arthritis, plantar fasciitis, bronchitis. Okay, so wherever we see itis, we're going to think inflammation. Okay, and so this is how we can decipher all manner of medical languaging just by breaking down the word into its Latin components and understanding what those little Latin root words are. Then we can understand a lot about a person's diagnosis without needing to turn to Google. Okay, so in this case, inflammation, okay, it's another way of saying heat or fire. If we're going to translate inflammation into Asian medical terms, okay, it translates as fire or heat, okay? And so the word meaning gives us some clues, and then from there we can focus on the individual person's symptoms, right? Because in Eastern medicine, we're always looking at the individual. We're always treating the individual. However, the individual presents is what we're working on. So it's very much in the here and in the now. Okay, so with anusitis, we see symptoms such as a burning sensation. Okay, so that's heat. Then there can be itching. Itching is another sign of heat. You can also get bleeding, and bleeding in many cases is also an inflammatory response. Okay, so all of these things are giving us a very clear picture of the heat or the inflammation present. Okay, and then we're going to further look at, what is the tongue doing? What is the pulse doing? For more clarity on how we're going to treat a particular case. So what I've seen in treating anusitis cases is that when you have a long-term anusitis going on, the tongue I've seen is bright red. Okay, that's the heat coming up again. And then what I've also seen is there can be cracking of the tongue. Okay, so the cracking is like a dryness, right? Like a desert. When you have the healthy fluids of the spleen and the stomach that get burned off by all that heat, then you can get tissues like the stomach, like the large intestine, tissues in the body that start to become very dry from the excess heat that has burned things off. Okay, so then we want to look at how does heat work in the body when it's there for a very long time. Okay, so it burns off fluids. That's something to really understand. Wherever you see heat long term, you're going to see the burning off of fluids, dryness. So in this case, what I've often seen is what's this cracking on the center of the tongue. The center of the tongue is the stomach area of the tongue. And when we look at tongue diagnosis, there's a mapping of tongue areas that represent different organ systems. So the center of the tongue is the stomach and the spleen. So what we want to see here, we want to see no cracking for one. We also want to see a healthy tongue coating. And so what that looks like is just a thin white coat is perfect. If we have a very thick coating, a sticky, damp, wet, right, or very thick kind of coating. This is too much fluid, too much dampness. On the other hand, when we see a totally stripped off tongue coating, like a mirror tongue, like there's no coating there at all, it's just bright red, then this is the dryness that's coming up. So this is what I've seen with cases of long-term anusitis, is this dry, the no coating and cracking. Okay, so it's really interesting to look to nature, because nature very often will give us a parallel picture of what goes on when things go wrong in the body, right? So if you have a very parched earth, right, if you had no rain in an area for, weeks or months, right, then, what you're going to see is you're going to see the cracking of the soil. And so this cracking that you see in kind of a desert climate is very similar to the cracking that you're going to see on the tongue when there's an absence of the moisture in the body from all of this heat, just like in a desert. So, okay, now the pain from the anusitis, this can come from swelling of the rectal tissue. So both the pain and the swelling are classic signs of inflammation. So some patients, they may also have rectal bleeding, which is yet again another sign of inflammation. Now, it's important to look at where the bleeding is coming from. Now, the bleeding will clear up with acupuncture treatment. Once we start to clear the heat out, the bleeding should also come to an end. But we want to know where's the bleeding coming from, and the way we do that is we look at the color of the bleeding. So if the bleeding is bright red, then this will be coming from the lower end, from the rectum, or from the large intestine. Okay, if the bleeding is the blood is turned dark, it's turned like dark brown or black, that means that it's further up the GI tract where the bleeding is coming from. So that in that case of like black, we're looking at, stomach ulcer, something like that. Okay, so that's a little bit of a different picture, but it's helpful to understand, because when the blood passes through the GI tract, it takes about 18 hours to get to the rectum. So by then, any bleeding from the stomach will have oxidized and turned brown or black. But if it's coming from further down, if it's coming from right in the rectum, right, then it hasn't had that time to turn color, to oxidize. So that's how we know where the bleeding is coming from. Okay. So for anusitis cases, what I like to use is a global balance treatment approach, where I'm balancing 4 systems. So the stomach and the spleen, the large intestine, and the lung systems. So I'm going to go over why I'm doing that. Okay, so the rectum is the lower end of the large intestine. So that's why that's in there. Okay, so the large intestine is carrying food products that are stemming from further up from the stomach. Okay, so often what you'll see in digestive issues is that things that are going on in the stomach are often carrying over to the large intestine system. So because of that, you want to balance both systems. So that's why the stomach is in there. Now, the spleen is the yin and yang it's the yin pair of the stomach, which is yang. So they're both connected in that way. So the spleen is helping to balance the stomach, and then the lung channel is there to help with the skin issues. Okay, so where we're getting the itching, the cracking of the skin, any bleeding or oozing coming from the skin. The lung system governs the skin, and it's also the yin-yang pair of the large intestine. So there's like a yin and yang relationship going on there. So the lung balances the large intestine. Okay, and so with these 4 channels, I then use appropriate points to quell the inflammation of these 4 systems. Okay, so the way I do that is I use Gua number 36, which is water over fire. So using water to put out fire, right? We all know that in nature, right? When there's a fire, you can use water to put it out. And so I use this Gua, which determines what points I'm using on the channel. So you're going to see a picture here of my point selection. And so this creates an anti-inflammation, creates more water element to quell the fire element going on these channels. Okay, and then so in addition to these channel points on the arms and the legs, you'll see in the center of my drawing here, I use kidney 16, which is right at the navel. Okay, so it's just on either side of the navel, and that is to mirror the rectum. Okay, the anus. The navel is like a mirror image of the anus, and so this way I can treat the anus without having to put needles in any private area, right? So this makes it very tolerable, right, for a patient to receive this treatment. All I have to do is just put a couple of points around their belly button and you're good to go. Okay, so then the result of this particular treatment, in my experience, is that the itching and the burning sensation decrease significantly over, let's say, 10 treatments, and then finally disappear with more treatment, finally goes away. Okay, I've seen the tongue that was bright red eventually get to a completely normal color, a nice pink color. Okay, and then where the tongue coating was completely stripped, right, with all of this burning off of the yin of the stomach and the spleen, so the coating starts to come back, like, just in a healthy way. Okay, and yeah, that's what I've seen. So this treatment plan works very, very well. And then in addition to that, I also recommend some self-care. So the first thing is using topical castor oil, okay? And so you're going to rub this liberally around the anus, because the castor oil, when it's used topically, it has an anti-inflammation effect. So it gets absorbed quite deep into the tissues, actually, and helps to quell that inflammation and that itch. So it makes it so much easier to, to get to sleep and to just function. Okay, so definitely I would recommend doing that every day. And castor oil is very messy, so you're going to want to use like an old pair of pajamas, because it's not going to come out of your clothing very easily. So just plan on that. Okay, and then the second thing that's really important is to avoid eating foods that are going to create more heat for the large intestine and the stomach as well, because it's an extension. So the foods that I want you to cut back on are red meats, okay, especially lamb. Lamb is very hot. You want to stay away from peanuts, chili, cinnamon, wasabi, vinegar, chicken, turkey, alcohol, eggs. So with eggs, it's the yolk that is more heating. The whites are okay. Then you want to stay away from garlic, ginger, and coffee. Those are the main ones I would focus on. And it's not that these foods are necessarily bad in and of themselves, okay? It's not to demonize them, but for a person that has a really active heat situation going on, like with the anusitis, these kinds of foods are going to make that worse. So cutting back on these until that all gets balanced and cleaned up is going to really help not aggravate the condition. So, some people are on, really special diets to help control the situation. And so if I can just make that a little bit easier by giving you a simple explanation of why you want to stay away from certain foods that are going to aggravate the heat and the itch and the bleeding and all of that, that's what I'm going to do. So I hope this is helpful for you, and I look forward to hearing your comments and questions and seeing you again in the next video. Thank you.